Up until this point, we've talked about this diet from the approach of being therapeutic for people. And it sounds like that's the people that are coming in to see you who I'm sure generally have weight they want to lose and they want to feel better. And they probably have a lot of different chronic health issues. Putting that out front, my question for you is, do you feel like this diet is the proper human diet? Or is it just good now for people that have quote unquote ruin their metabolism having too many carbs throughout a lifetime? So if somebody were to come into this world and have a moderate amount of carbs and then come and see you when they're 30, 35, would they need to go to this? Or is it just for people that have broken their metabolism?
Yeah, that's a great question. I think those who are smarter than I, the people who've looked at history and the evolution of things, the hunter-gatherer, paleo, primal, ancestral way of eating certainly was one without many carbs. That's pretty clear. Now, you could argue, well, maybe it doesn't mean it's better just because it happened that way. The introduction of carbs happened relatively recently, and there's really very few controlled or even observational studies of following people who haven't had carbs and have had carbs to a great degree. So we don't have clinical trial studies. It would be a shame if you had to wait until someone had a metabolic problem to change something. You want to be able to prevent this. I think that's the new frontier for research, and that is let's assume we don't know the answer. Let's take some kids, take some young adults, randomize them, follow them. Some eat carbs, unlimited, if you will. Others don't. We restrict it to see how they do. The common element, though, is it seems to me kind of logical and common sense and theoretically correct to limit sugar. And we don't need clinical trials to limit sugar. Of course, you could have argued that, well, doctor, you're telling everyone to lower the fats. And we didn't have clinical trial evidence back then to do the low-fat diet. But the signal is so strong. I think so let's say actually, I think Jeff Volek, last I talked to him, said about a third of Americans do fine eating carbs. And it seems like they can live long, healthy lives. Of course, which carbs, I don't know. Seems to me that people who become diabetic and go to weight loss surgery are the ones who have a huge carb intake. And they might even be the sugaraholics. They end up getting the diabetes and they can't control it, so they get weight loss surgery. But I think measuring the glucose and insulin early, that would be a way to do a fairly quick study among really any age. And from my vantage point, the healthful signal is that this would be preventive of all of these different problems for 2/3 of Americans. So it's not like you're gambling on only helping 1% here and there. It's a large element. Now that gets us back to the proper human diet. Did you know that children are born into this world in ketosis? They're actually, babies are born without eating carbs, and they have ketones. Now, the measurement of that, it's fascinating. No one really measures ketones these days. They measure sugar, glucose, and then they worry about the babies having enough sugar. And that element of, after 2 days, you become a fat burner. Everybody does. It's not just you and me or based on religious belief. We store fat on our bodies. And so that's why we burn it if we don't eat anything. That is kind of the logic that it's leading me kind of late in the game. I mean, I've been in this world 20 years. Maybe this is the default way to eat. We store fat. not sugar, and you want to limit the amount of sugar and to some degree, and in 2/3 of Americans, maybe to a large degree. But it's hard to, for me as an academic, to say yes, this is the best, because I would really love to have a controlled trial of this versus another way of eating, and everything looks better when you compare it to the standard American diet. That's not a very good approach. But measuring the glucose, the insulin, the other sort of metabolic parameters that a doctor typically measures, that all looks good. And you might even have some ketones. That's okay. Your doctor might freak out, but you may have some ketones. That's okay. That's normal. And then there's a company now that's allowing you to get your own blood tests done without a doctor order, or and without them even getting access to it. So we're getting a peek into thousands of people who are getting their blood done. It's called ownyourlabs.com, and you say what kind of diet you're following. In fact, I'm looking forward to some data presented about this. We have a hunch that, of course, ketones are going to be higher in those who don't eat carbs. And I think LDL is going to be a little higher in those who don't eat carbs. And maybe even the A1C might be a little higher. It doesn't mean it's bad. It's like a new normal range that is going to be created, so you don't have to worry about comparing yourself to those who eat carbs.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
I've had people, even if they've been on insulin for 20 years, get off the insulin in as little as 8 weeks. The weight loss happens about 1 to 2 pounds per week. My philosophy is to get it to work the first time.